The Prime Minister made an impassioned appeal to the nation.
On social distancing and the further measures that we may bring in, well, I don't think you need to use your imagination very much to see where we might have to go, and we will think about this very, very actively in the next 24 hours. We need to think about the kinds of measures that we've seen elsewhere, other countries that have been forced to bring in restrictions on people's movements altogether. But it can only really be preserved if everybody acts responsibly and conforms with those principles of staying apart from one another and social distancing. I know it's hard, but that's the best way forward. If we can't do that, then I'm afraid we're going to have to bring forward tougher measures.
But have these words come too late? Clearly, in parts of the country, some people have not been following the advice to social distance. This was Columbia Flower Market in East London this afternoon. Like at several other markets and parks in the capital, people were out in crowds, socialising in close quarters, despite a clear warning from the mayor.
Don't leave your home unless you really, really have to. Work from home. Don't use public transport unless it's genuinely essential. Look out for your neighbours who are elderly and vulnerable. Do some shopping for them. Leave it on their doorstep.
But it's not just the springtime mood apparently engulfing some in the country that's the problem. Witness the queues outside some supermarkets too. Standing this closely together goes against advice on social distancing. But can ordinary people really be blamed when advice from government has changed so quickly and at times seemed conflicting? On Friday, the Prime Minister suggested he would visit his elderly mother today.
I'll certainly be sending her my very best wishes and hope to get to see her.
Today he wrote in two newspapers, the Sunday Times and the Sun, urging people, don't visit Mum today. The Sunday Times also alleges the Prime Minister's chief advisor Dominic Cummings had initially been keen for the country to adopt a policy one observer characterised as herd immunity and let the old people die, but had been convinced shutting down the country was a better option after seeing what was happening in Italy. Downing Street denounced the report, saying it was a highly defamatory fabrication. Channel 4 News has learnt that French authorities were preparing to shut down the border with the UK on Friday afternoon. France has imposed a strict lockdown, and President Macron is said to have been furious at Britain for not taking more stringent measures to tackle coronavirus. We understand the plan to close the border was only dropped when France was told the UK would now be taking a tougher line. And while questions continue to be asked about who or what is actually driving government policy, already people are dealing with coronavirus at its worst. This is actor Sophia Myles saying goodbye to her father, who died in the last 24 hours. She posted this picture to remind people of the harsh reality. Well, look, I've just come from inside Downing Street, from inside that briefing, and I think it's fair to say the Prime Minister is clearly still very reluctant to impose the kind of lockdown that we've seen in France, Italy and Spain. His tone was still very much an encouraging one, but also a warning there, saying, look, if you don't follow these measures, we will have to try and bring in further measures. He warned against congregation, telling people, stay at home if you can, but if you do go outside, and it is still okay to go outside and take a walk in the park, but you need to not congregate. Stay 2 metres apart. It's not that difficult, he said. The other thing that we're hearing now is that the Prime Minister insists very much that he is still being guided by the science, and that is influencing all of the government's decisions. He is absolutely insistent on that point. In terms of measures, the big thing that we're hearing is that the introduction of this policy that they're calling shielding, i.e. 1.5 million people who are considered to be the most vulnerable, those with cancer or severe respiratory diseases, they're going to be contacted by the NHS via letter or phone or text and told to stay at home for 12 weeks. So that's not social distancing, that's a further measure for those who are most vulnerable. And that's the next stage in the government's policy, but very much insistent they are being guided by science and not politics. Jackie.
Thanks, Fatima. The Home Office has confirmed the first case of coronavirus in an immigration detention centre after a woman being held at Yarswood in Bedfordshire tested positive. Home Office officials say the person has been placed in isolation after displaying symptoms, and no one else among staff or detainees has tested positive. Campaigners are calling for the release of hundreds of detainees because of the risk that they or staff could contract the virus. Well, joining me now is Professor Helen Ward, Clinical Professor of Public Health at Imperial College London. Thanks very much for joining us this evening. I just wonder what you make of the latest advice coming from the Prime Minister.
Well, there's a lot of public health specialists, senior leaders who've been discussing this over the weekend, and I think most of them, like me, will be very disappointed. It seems to me that there are mixed messages. I know that the Prime Minister said that people should reduce their social contacts outside of the home, but has not yet done anything to enforce that. Going back to the science, which he says is guiding everything they do, the work that came out of Imperial College said that those social contacts outside the home have to reduce by 75% if this is going to work. Now, it's clear from what's been shown today that is not happening yet. And therefore, closures of some of the shops that are not necessary, some of the parks, etc., are going to have to be enforced. But more importantly, I think making some restrictions on travel and unnecessarily travel. The moment it's all voluntary, and unfortunately people are not sure that they want to do that.
I mean, were you surprised to hear the Prime Minister again today? It was gently appealing to people to do the right thing, when it would seem, certainly from the evidence of what we've been filming today, people are not doing it, certainly not enough of them. Were you surprised that he didn't take a tougher stance?
I was surprised because I think that the evidence from elsewhere in the world is that you have to take a really tough stance and you have to take it early. You have to have the places that have actually got this under control and got numbers of cases starting to go down, new cases, like South Korea, they have had a major investment in testing, very, very widespread testing, contact tracing and reduction in social contacts. We have, if you think you're going to put these measures in place in 4 days' time, if it doesn't work now, 4 days is a lot of extra cases. So I think last week when we had the pubs and clubs and don't go to them, but not enforced, we lost 4 days and then they enforced it. I think we are urging the Prime Minister and the government to take the bold steps that are necessary now and not wait another 4 days.
It is, as you say, quite interesting. All the way along, the government seemed to have been reluctant to take what he said today were draconian measures. So we saw other people leading. So, for example, at the same time as he was saying mass gathering sport could go ahead, we then had the Premier League moving in and saying we're going to cancel all games. Today, he's still saying to people, be responsible going out into the parks. But we have some parks across London being closed by local authorities. Why do you think he is so slow, or in your view, he's so slow to enforce these things?
Well, he actually poses it in terms of a draconian sort of clampdown as opposed to people enjoying themselves. And I think that's the wrong message to be given to people, that it's one or the other. I think you have to say this is an emergency. We have to get people to comply with this, and we have to do that at a local level. And I think local authorities are quite right to be taking these measures, and they need to have the backing of the government to enforce them. But it's not just that. A lot of communities and shops and other things are actually doing the right thing. They are closing down and shifting towards supporting the most vulnerable. We've got hotels that are saying that they're going to be available, extra capacity for whether it's for the NHS or some have suggested for refugees, for people suffering domestic violence as a result of the isolation. There's many things that could be done. But the Prime Minister does seem to want to be one step behind.
And do you worry that he says he's being led by the science, but actually he's being led by his political instinct? It's said that he hates the idea of nanny state interventions. Do you worry that it's politics rather than science that is leading him?
I think that the science that is informing this has been good. I do think there's a lack of experienced public health leadership in helping the government make those decisions. We do have the CMO and the scientific advisor, but there is a huge network of public health expertise around the country that I don't think has been drawn on enough. People that were communicable disease control experts who've been planning for epidemics and pandemics for years. I don't hear their voices enough influencing government.
We are being repeatedly told that we're 2 weeks behind Italy, and we are seeing horrific numbers of deaths coming out of Italy. Is it too late to delay that level of fatalities here, to do something about it?
If we want to stop things, if we're 2 weeks behind, then we have 2 weeks to stop that, in a sense, and we have to start today, because it's the infections that are occurring today that are spreading in Colombia Flower Market, for example. Those are the infections that in 2 weeks' time will be causing deaths and intensive care use. And that's what we have to try and stop now.
And so you think enforcement has to come now?
I think there has to be clearer messaging. I think that it is different in different parts of the world. It's not just about limiting contact between individuals and the spread that way. It's also between hotspots like London and other parts of the country. And I think we need to look carefully about limiting travel between areas.
So, for example, just very briefly, in Germany today, we see no gatherings of more than 2 people outside of home and work, potential fines if social distancing measures aren't adhered to. Are those the sorts of measures we should at least be thinking about now?
I think we should be, and I think we will almost certainly have to bring them in, but it takes time. So we need to start that now, not say, oh, we're going to think about it and maybe do it next week. Next week is another several tens of thousands of cases and more pressure on the NHS and more deaths.
Professor Helen Ward, thank you so much for talking to us. Thank you. Parks, beaches and other public spaces around the country are being closed down, while the authorities in areas like Yorkshire, the Lake District and rural Wales are urging non-residents to stay away, saying the numbers of people flouting orders to avoid social contact at a time of crisis is simply unacceptable. From Windermere, our North of England correspondent Claire Fallon reports.
We were told to stay at home, but with the sun out, not everyone did, despite the warnings of what's at stake. So many headed to Snowdonia, this road became an overflow car park because the actual car park was full. And in the lakes, police asked visitors to stay away, but still they came.
You've not got it, Michael, have you?
No.
Many seem to think the warnings were for other people, not them.
If I start coughing or there's some signs, yes. But no, I'm fine.
Are you surprised there are so many people here today?
I know, yeah. It'll be it though after today though. I'm finishing tomorrow.
Are you?
Yeah. That's it. Closed down.
Tony's been selling ice cream all his adult life. He lives not far from here, in Kendal. He told me most queuing at his van seem to think they're fine as long as they're outdoors.
Yeah, but it isn't really, is it? No. I mean, I should be here really. So, but looks like we're going to be off for months.
This is no longer just about at-risk groups. We're all being asked to stay in as much as possible, venturing out just for exercise or to walk a dog or to do things that are essential. According to the government, when we're out and about, we should be trying as much as possible to stay 2 metres. That's roughly the length of our microphone pole, away from other people. So somewhere like this, we can do it. And I'm at least 2 metres away from cameraman Neil at the moment. But when you're walking along a pavement, for example, with other people cutting past you, if you're queuing up to buy an ice cream, it's not 2 metres. And so increasingly, we're being asked to just stay at home. The NHS and social care aren't resourced for day trippers, second homeowners and isolation-cationers. There are fears services could be overwhelmed by the influx at the expense of people who live in rural areas. People like Sharon and her parents who live in Windermere, who after days cooped up, had ventured out, cautiously.
It is Mother's Day. I have got them in the car. This is the only part where they're out and we're trying to be as far away from people as possible, and like I say, we've brought our own food and drinks.
But for many, today has been spent at a distance, whether it's miles or just a few metres. And as we're asked to stay at home to save lives, we will find new ways to care and love and live.
Claire Fallon reporting there. Now, if you want an example of how quickly COVID-19 is spreading around the globe, how about this? It took 90 days to record the first confirmed 100,000 cases. The second 100,000 took 12 days to record. The third 100,000, recorded today, took just 4 days. Italy reported 651 more deaths today, while Germany's Chancellor Angela Merkel has gone into isolation after a doctor she'd been in contact with tested positive. The New York City mayor has said the lockdown there could last 6 to 9 months. Kamian Zerum reports.
Sondalo Hospital, northern Italy, where the morning ward round starts with a pep talk by megaphone. All over Italy, people are thinking of you, Dr. Sarah Barbuto says, before playing the national anthem over her mobile phone. Sunday in St. Peter's Square, like so many public places across the world, is deserted. And the Pope's weekly prayer, a dreadful reflection of our times.
Uomini e donne che muoiono soli.
We hear of many people dying, men and women who die alone, unable to say goodbye to their loved ones. We pray for them, and we pray for their families who can't accompany those dear to them in death.
La nostra preghiera speciale è per I defunti e I loro familiari.
The overnight numbers from Italy are grim. Slightly fewer than yesterday, but still another 650 dead. The lockdown when it came, and monitoring shoppers for fever, too little, too late. European nations ignored the warnings from China, Korea and Singapore, by and large failing to trace infections, failing to enforce distancing. The Germans have now threatened to introduce huge fines, possibly thousands of euros, for gatherings of more than 2 people. And the Chancellor herself is tonight in isolation herself after being treated by a doctor who's since tested positive. And now Italy, epicenter of the pandemic, is the recipient of aid. Cuban doctors dispatched to Lombardy. And supplies being sent from Russia. It's not all cooperation, though. While the French are sending shipments to Iran, the US has been urged by many that now is the time to drop, not increase, its sanctions. And the Iranian supreme leader said a US offer of help was in fact a plot to spread the virus itself. In New York, the mayor, Bill de Blasio, warned the city that never sleeps could be shut down now for the rest of the year.
I don't get it. Right now, I have asked repeatedly for the military to be mobilized, for the Defense Production Act to be used to its fullest, to get us things like ventilators so people who can live who would die otherwise. Chuck, I can't be blunt enough. If the president doesn't act, people will die who could have lived otherwise.
Across the US, empty streets. As reports emerged, the richest country in the world is preparing a $4 trillion domestic aid package. But what on earth can governments do in countries like Kenya, where furious market traders were told today to pack up by the army? The country's seen no deaths and only 15 cases so far, but they are on the rise. We have no choice, the traders said, but to take our chances. How are we expected to survive if we can't work?
Life has changed beyond all recognition in just 1 week, as many in this country, like others, get used to the idea of spending many months at home, some of them all on their own. Few people know what living in isolation is like better than Terry Waite, who spent almost 5 years as a hostage during the Lebanon civil war. We've been talking to him, along with experts and others who've experienced long periods alone, to hear their advice and encouraging words. We are all in this together. Remember, you are not alone.
My name's Terry Waite, and during the days when I was working as a hostage negotiator, I was captured in Beirut, and I spent almost 5 years in very strict solitary confinement.
I'm Augustine Fuentes. I'm an evolutionary anthropologist at the University of Notre Dame in the United States.
My name is Anne Welsh. I'm a blogger, I'm an author, a businesswoman, entrepreneur, and I suffer from a blood disorder called sickle cell anemia. I needed to be isolated for 2 weeks to make sure I didn't pick up any more infection.
My name is Dr. Jonah Lipton. I'm a social anthropologist at the Centre for Africa at the London School of Economics. And I specialize in the 2014 to 2016 Ebola outbreak in West Africa. I learned in Sierra Leone during the Ebola crisis that for ordinary people, surviving Ebola was not simply a matter of avoiding contagion or getting treatment. Those were very important, but it was also a matter of getting through the crisis in a meaningful way.
Nobody knows at the moment what the future holds. So the way to deal with that, take it one day at a time. You can't make many plans for the future, but you can live today as fully as possible. So do that.
You have to take away your denial that this is something happening to you and start moving yourself from a sense of denial to acceptance. And I think the most absorbing enjoyment phase of the whole isolation for me is once you get to that accepting phase, because then you start thinking of things to do.
And you can begin to find that solitude is actually something that's really quite remarkable. You will discover that you have within you abilities and gifts that you never knew you had.
And I started writing my book because I said, I have all this time on my hand. Why should I just sit back and do nothing with it? So I started writing.
So I used to write in my head. It was only put on paper when I came out. So I had to develop my mental capacities.
We need to really think about what are the dangers, what are the harms, but also what are the patterns of resilience? What are the patterns about being a human that are going to help us cope with this and make it through and come out the other side okay?
Everybody needs some sort of a framework within which to work. Now, when you're alone, you have to create your own framework. No one else is going to create it for you.
Now I've made a very, very nice schedule for myself that actually I'm now looking forward to tomorrow, because tomorrow is actually going to be busy again.
I think social distancing is a confusing term, but actually in many ways during a crisis and an epidemic, social proximity is very important. That proximity might not be physical. We do have to keep our distances from one another, but we actually really have to be there for each other.
Maintaining those connections is a critical part of maintaining your physical health, so that should you be unfortunate and unlucky enough to catch COVID-19, your chances of sort of keeping your body as well as possible are going to be helped by staying as social as possible.
Crises and epidemics in particular are kind of like holding up a mirror to society. They show you what's working in society and maybe what's not working, and the things that maybe went ignored that weren't working all along.
I would hope that society would come out of this for the better. I mean, there are no guarantees. I would hope it would show us that, well, there is more to life than just amassing money.
What the hope people should have is that we're all in this together. So this is something that we should take pride and joy with, knowing that I'm not suffering alone. We're all suffering together.
Take it positively. Take it as a constructive experience, and don't let it get you down. Keep hope alive, and that gets you through.